Why are Botox injections used for OAB symptoms? Imagine a treatment that helps calm an overactive bladder and gives you relief from constant urges to go. That's where Botox injections come into play for overactive bladder symptoms. They are used because they can significantly reduce involuntary bladder muscle contractions, which are often the main cause of urgency, frequent urination, and leakage. Botox works by blocking the releases of a chemical called acetylcholine, which nerves use to tell the bladder muscles to contract. When this chemical is blocked, the bladder muscles relax more easily, allowing the bladder to hold more urine and decreasing sudden urges to urinate. But Botox doesn't just affect the muscle contractions. It also impacts the nerves that send signals about bladder sensation. It reduces the releases of other neurotransmitters like substance P and calcitonin gene-related peptide, which are involved in the sensation of urgency and pain. This means patients often experience less discomfort and a decreased feeling of needing to go urgently. Additionally, Botox can help modify abnormal reflexes between the bladder and spinal cord, which can contribute to incontinence. Typically, Botox injections are considered when other treatments, like behavioral therapy or medications such as antimuscarinics, haven't worked or aren't tolerated. The procedure is done in an outpatient setting, usually with local anesthesia. A healthcare professional inserts a small camera called a cystoscope into the bladder and injects Botox into the bladder wall. The effects usually last between 6 to 9 months, after which nerve endings regenerate and symptoms may return, requiring repeat treatments. From a bladder health perspective, Botox is a well-established second-line treatment that can greatly improve quality of life for those with severe or refractory overactive bladder. It is generally safe, but some people may experience urinary tract infections or have difficulty emptying their bladder. In such cases, they might need to use intermittent self-catheterization temporarily. It's important to note that Botox injections are not a treatment for bladder cancer. They are aimed at managing symptoms related to bladder overactivity and do not affect cancer itself. Good bladder health involves proper management of urinary symptoms, and Botox can be a helpful tool in that process. In summary, Botox injections are used for overactive bladder because they block nerve signals that cause the bladder muscles to contract involuntarily. They also reduce nerve activity related to urgency and pain, helping the bladder store urine more effectively and decreasing episodes of incontinence. Always consult with a healthcare professional to see if this treatment is right for you and to discuss potential benefits and risks based on your individual health needs.